The fairy tale goes, mirror, mirror on the wall, who is the fairest of them all? Fact of the matter is, it's not who is the fairest, it's who all are the fairest of them all. And the people responsible for those perfect noses, unblemished faces, and flat as an ironing board tummies are none other than plastic surgeons. Manjege, plastic surgery is a surgical correction or restoration procedure of certain parts of the human body. Plastic surgeons are surgeons or doctors who deal with replacing, repairing, or reconstructing various parts of the body. Most often than not, these are often facial features but can also be other parts of the body, such as the torso or the hand. These are the people responsible for assisting a burn patient with a new skin graft, reconstructing the burn to look as natural as possible, or an accident victim reconstructing a new jaw. They are also responsible for enhancing certain parts of the body you may not be happy with, or adding a nip and a tuck to an unflattering area. With a certain neck to create the perfect features, plastic surgeons are highly skilled individuals who make us feel happy with how we look.
Plastic surgeons are fully qualified medical doctors who specialize in replacing, repairing, or reconstructing various parts of the body. These are often facial features but can also be other parts of the body. Before qualifying as a plastic surgeon, one must obtain a qualification as a medical doctor. Plastic surgeon hopefuls should start off with a senior certificate with an exemption for admission at a medical school. Subjects such as biology, anatomy, algebra, and English will make the following years a little easier. A plastic surgeon must be driven, focused, and self-motivated, should have a strong desire to help others, and must have good bedside manners. Because of high demand for cosmetic and reconstructive surgery, job opportunities for plastic surgeons will always be available in government and private hospitals.
All right. Plastic surgery ki tiro ya bongaka e leng gore ra etsane mara e bereka ka di operation. So gona le mafapha a mabedi a plastic surgery. One side ke mo e leng gore re busetsa dilo tse e leng gore motho o di lusitse mo mmeleng wa bona, so ke reconstruction. If o kry le gore gona le part ya mmele e motho a ilusitseng, then re a reconstructor basically. So e ka ba tsebe, e ka ba nko or anything else mo mmeleng, then ke reconstruction. The other part ya plastic surgery ki cosmetic surgery. And ka cosmetic surgery ke mo ileng gore batho ba enhancer beauty. So leona again e ka nna any part of the body mo ileng gore motho o batla go enhancer beauty, either mo sefatlhegong, either mo matsoleng, either mo dimpeng, or anywhere else in the body.
How long did you take to study, and what are the required conditions in this field?
Usually it starts all in high school. Mo ileng gore ntwengela, you have to study mathematics and physical science as the requirements in your matric for only accepted for your basic degree, which is the medical degree, MBCHB. Then after high school, then we are go university with that medical degree. So honale the university tse long for the offer that course more South Africa, for instance. So ho feditse then ubidiwa doctor. So koro o general doctor. Bo doctor baba bitiwang gore ke di general practitioners. So immediately after that, then o kanne wa tswela pele ka di further studies, and one of them koro o choose each and every part of the body e ulong gore wa e batla go etsa that particular specialty. So plastic surgery is one of those tse ilong gore o ka di etsa after o qualified as a medical doctor. So then it longa, the initial one was 7 years for o study a doctor. 7 years a doctor. Then from there it's what they call an internship, whereby ubereka under supervision. Then aufetsamu it's a community health, mo ileng gore ubereka under less supervision. Mara sonzo go bele motho ileng gore o mo go wena, I mean o above you wa go supervisor. Then go feditse that, then we are another 5 years ya no mo ileng gore o specialize in plastic surgery. And even after that, go sheba plastic surgery, onale How to specialize as a plastic surgeon or general plastic surgeon? So still from there onwards, we can see some more further studies in plastic surgery. Mo ilong gore o ka specialize ka dinko fela, o ka specialize ka matswele fela. But now that will be add some more years into your basic 5 years of study plastic surgery.
Being a plastic surgeon requires many years of study and an ability to recreate. These highly skilled individuals spend years perfecting their craft and also receive the deserved salaries they get from creating perfection. A plastic surgeon can potentially earn a salary which ranges between 700,000 rands to 2 million rands per annum or per year. This can amount to 60,000 rands to 160,000 rands per month. Now, a plastic surgeon can earn even more if they have their own business. Kumbula-ke ukuthi a plastic surgeon can fall into the fields of cosmetic and corrective surgery, meaning that either they can assist in enhancing the features or they can assist in correcting birth defects or injuries sustained due to accidents. Cosmetic surgery can be extremely expensive, and often the plastic surgeon will see a high-profile clientele. Plastic surgeons will also work on pro bono cases where reconstructive surgery is necessary for people that cannot afford to fix various defects. Amanye amathuba for plastic surgeons include burn surgery, craniofacial surgery working on abnormalities of the face, hand surgery, microsurgery working on missing tissue, and pediatric surgery working with children. Manje, this can be a very rewarding career to get into. So let's check out what a day in the life of a plastic surgeon is like.
The patient has got the wound. We have cleaned it with antiseptics. It's very clean now, but we're just preparing the wound for a skin graft. Forkman spoon. So we just clean it until we see contact bleeding. Then we know that it's now ready. When a wound is bleeding like that, then it means that the wound is clean now. Then now we are going to take a skin graft that we are going to place over there. Press that side and okay, then now we have our skin. Then we take the skin, we put it on the wound. Can you still follow? Then I'm putting the skin now onto the wound and securing it so that it doesn't fall off until it sticks. Then we'll need the adaptic. Then we put a certain dressing that we call adaptic. So you can see now there is the skin sitting on the wound. The operation is actually almost finished now. Okay. Then we put another dressing that we call Acticoat. So that skin will open after 5 days, and the skin would have got stuck now. So because the wound could not heal without that skin. And now we are left with this wound. So this wound will usually heal by itself because we have taken, you saw the skin was paper thin. Generally, the whole operation now is finished. Okay. Then finito. So that is what we meant by skin graft. We take skin from somewhere, then we put it in the wound so that the wound can heal. Then from there onwards, we'll wait for the team to wake up the patient. And this wound here will gradually heal after 1 to 2 weeks. And so both wounds will be healed and the patient doesn't have an open wound.
Dr. Selate, Subonile during the operation, ususa inyama yomuntu and putting it on another part. Does that rotten part, Sibonile, is it gonna, is it polar or is there still gonna be some bruises?
That part is gonna grow wherever we have put it and it's going to close that wound completely. But now where we have taken that skin from, it's only part of the skin that is left there. So a new skin is going to grow in until that wound is covered. So both wounds will like heal in a week or two, both of them.
Ngathi plastic surgery is an interesting career. Kodwa ke mina, I can't do it. Blood just is not my thing. But when lapha, if you can stand blood and have a passion for the human body, then you would need to be a strong candidate in physical sciences and maths to be accepted to study to become a surgeon. Amanye recommended subjects would include life sciences and English. But remember that it's not everyone that can become a surgeon. It takes years of hard work and dedication with good marks to become one. Manje, if your marks qualify, you could go into any of these tertiary institutions. You could go to UCT, the Wits University, University of Free State, and the University of Pretoria, amongst others, as they all will help your dream of becoming a plastic surgeon come true. Manje, plastic surgeons must complete medical school training and then embark on a plastic surgery residency period. Now, residencies for plastic surgeons tend to be longer than those for less specialized medical doctors, lasting 5 to 7 years instead of 3 to 7 years, with an additional year of residency for any other subspecialties. Now, to be a plastic surgeon, you must have good judgment and have strong technical expertise. You also need to be very ethical as you are dealing with clients who are depending on you. Plastic surgeons must have good communication skills to explain medical terminology and procedures to patients wabo and to provide emotional support. They must also have a passion for their job and helping people. Almost a plastic surgeon uzobusebenza kwi-hospital okanye a private clinic. Plastic surgeons must master a multitude of procedures, some which are very tricky and personal procedures. Impilo ye plastic surgeon is not as glamorous as it may sound. Amanye plastic surgeons may work for hours in a 40-degree operation room, reconstructing a mangled limb or an injured face. Days off might not be spent resting, but used to prepare a lecture for peers who are invited to criticize your work. The surgeon's shift might start as early as 5 a.m. Kodwa when nangabe you are keen for the inventive in a career with ever-changing possibilities and dream of changing someone's life, then this career is for you.